So this is the area where we are planning to put an implant. So that is exactly in the 2627 region, and you got a paramolar over here, probably a supernumerary tooth. And right in the center, if you have a look, you can see there is a septum over here. Something looking like a septum. It's actually not a septum. This could be the bone that is remnant in the palatal root of this upper molar. This tooth was extracted 6 months ago. So that time we had grafted this region for socket preservation. So we got a good bone in the center region of probably 1617 region, which is actually the area which was the palatal root of first molar. So we had grafted this area, and as we planned, we could get enough of bone over there. Now if you see the CBCT X-ray over here, see what you see here is probably the crown region. This is the mandibular teeth. As we move up, you can start seeing the paramolar region and the premolar region. So this is something like a section as driven from mandibular area to the maxillar region, and we are slowly reaching to the crustal bone, which is supposed to be here. Can you follow it? The crustal bone is over here, which is not yet in view. Now if you move a little bit up, you can see the paramolar happening to be seen. Then slowly the crust will start appearing. You can see the crustal bone appearing. So the crustal bone is more in the premolar region and less seen in the molar region. That means there is a slope to the molar region. Now still going further, you can see the whole crustal region right from the premolar to the paramolar, but there you can see the sinus flow. So that means the sinus floor is very deep, or the depth of the sinus floor is more in the ridge of this area next to the premolar region. So that area you cannot plant an implant. But here you can have the 6 distal area to the 6 and the 7 region. It seems to be having a very good bone, at least in its width. Let's see how deep the bone is when you go still further apically to that first molar region. See, the other sinus base starts to be seen. So that means in this area, the palatal root of upper molar or the upper molar region where we had grafted has got considerable amount of bone, but next to it, onto the mesial side and distal side, it's sinus floor. So you still go further. See, the sinus starts to appear more evident. That means it's more of sinus floor on both the sides, and there is a septum here which is more prominent on the palatal side. Can you see this? It's on the palatal side. So this is definitely the palatal root area. So if you're planning an implant here, if you go still further, see the whole area open up into the sinus. So sinus down, if you go, then you can see the palatal area having a little bit of bone. So if you're planning a implant here, it should be with a sinus lift in the palatal region of the first molar. That's how the CBCT explains. See, as you go further, this is the crustal area itself. You can start seeing the sinus floor next to the premolar. And if you go further, you can see it is coalescing and becoming a big cavity. This is the bigger sinus. So this is how CBCT is read in this software. It's a nice software and a handy one too. So our plan is to have an implant planted in this region, probably around 8 mm distal to the premolar and towards the palatal side, and if possible without raising much of bone, exposing the periosteum, or even raising a flap. So we planned for a flapless surgery in this case, which could be done right in the spot with minimal drilling and maximal expansion, so that this palatal side will be expanded towards both the sinus region. So a good diameter implant can be planted here with expansion to the mesial and the distal area, utilizing the complete possibility of the length which is up till here, up till this region. So the possibility of 6.5 into 4.25 is planned here, but with a little bit of sinus lift you can go up to 8 mm. This was the plan, and let's see how that was executed.